Good afternoon, everyone, and thank you for joining us for the second webinar in our Business Sustainability, COVID-19 Recovery, and Adult Day Healthcare free webinar series. My name is Jeff Diamond, and I'm the Policy and Communications Manager for Leading Age New York. Before I turn things over to our presenter, I'd like to quickly go over a couple housekeeping items. If you have any questions during the presentation, you can type them into the Q&A box in your webinar controls. We will also be emailing the slides and a brief evaluation to all participants once the presentation has ended. Today's webinar is titled The COVID-19 Aftermath, Team Building and Responding to Trauma, and our presenter is Dr. Robert Figlerski, Director of Behavioral Health Services for the Mid-Atlantic region of Team Health, one of the largest providers of acute and post-acute care in the country. Prior to assuming this role, he served as Clinical Director for RG Psychological Services, another leader in the area of post-acute care, providing psychological services to residents of skilled nursing facilities, assisted living, and ADHD programs. Dr. Figlerski began his career as Executive Director of the Hofstra University Health Dome, a nonprofit health psychology institute with one of the largest bariatric treatment programs on the East Coast. He received his PhD in clinical psychology from Hofstra University in 1984. Without further ado, I'll turn things over to Dr. Figlerski.
Thank you, Jeff. Good afternoon, everybody. Some challenging times we're going through. I've done a good deal of work in adult day healthcare programs over the years. And I find it to be probably one of the single most important programs or single most important efforts to help manage the health and well-being of very vulnerable communities. And importantly, not only maintaining their health, but keeping them in their community, keeping them at home, very importantly, keeping them with their families, and really out of institutional care. So from my point of view, this recent closure due to COVID-19 has had a tremendous negative impact on the health and well-being of thousands of individuals who benefit from your services and have actively made their attendance in your programs a part of their life. From the family's point of view, a great resource to help their families stay together. So where do we go? Well, we're kind of in limbo right now when opening dates will happen. I really have no information on that more than you do. So it's with anticipation that we have to start putting together what it might be like in reopening and what considerations we're going to have to make. Some of your programs probably might have held together and you're going to be able to go back and just contact your team and get your team back. Others of you will have to rebuild your team. And those members of your team coming back with their own experiences in this pandemic, reaching out to registrants, beginning to figure out a plan so they can have confidence and families can have confidence in your program and address that fear about being infected by COVID-19, what kind of precautions you're going to be taking. So there's the nuts and bolts of infectious disease and setting up procedures, and then there's the more powerful psychological aspects of this, anxieties and fears. So today's webinar, we're going to go through some things that I hope you'll find helpful. We're going to talk about conceptualizing what this challenge is going to be like. You all have active imaginations, so I'm sure you have some of your own ideas. My list is not exhaustive or particularly right or wrong. Depends on your situation and the population you service. We're going to talk about something very important, and that's sustainable leadership. From everything I understand, we're not going to be getting over this COVID-19 anytime soon. It's going to be percolating and maybe reduce numbers, but has all the potential to come back with some force, which is going to create a lot of fears and anxieties. So we're going to have to really think about our role in leadership and what that means, and in building a resilient team, developing loyalty among staff, helping your staff feel confident and safe, helping them communicate that to the registrants. And that is a tall task. We're also going to be talking about trauma, not only in terms of registrants who've been traumatized, or possibly traumatized by this experience, but also your staff members. We're going to be talking about a concept called post-traumatic growth, and then just generally some visionary topics about what to anticipate and what to plan for. So we're going to try and really cover a lot of different bases here. I may not have all the answers, but hopefully what you leave with today might be some questions for you and for your staff to sort through. I recognize I've been doing this long enough. I recognize that not all programs are the same. So not all interventions and not all suggestions are going to apply. But I do think there'll be enough questions and enough thought that can be applied that you'll come up with some general ideas and some a game plan for how to move forward. And right now, even at this point, even though your programs are closed, there's nothing to say you can't begin your planning. You can't begin making your phone calls. You can't begin sketching out what your program is going to look like. This might be an opportunity, that concept of creative destruction, in that, with this opportunity, with this pandemic and the challenges, there's an opportunity to revitalize your program maybe in ways you couldn't in the past. So let's move on with the presentation and we'll get started. So first of all, we need to help conceptualize what we're dealing with. And as I said earlier, this is not about a sprint. We're not going to be able just to get through this, get over it, and move on. Until there is a vaccine, until we better understand what this virus is like, we are going to be dealing with this issue for the foreseeable future, which means we need to pace ourselves. We need to think about short-term, mid-term, and long-term goals and how these challenges will shape our program and our approach. This is really a marathon, and if any of you on the webinar are runners, you will certainly appreciate the difference between running a 100-yard dash and running 26 miles. And mostly it's mental toughness and a vision for what the race looks like, and pacing yourself, being patient that the marathon is run not as quickly as possible, but as smart as possible. And you're going to have to begin to take small steps and build from that, making sure and being concerned for your staff that there's no burnout. Get prepared for setbacks and how we might respond. Morale will be a very big issue. And that certainly is true in running a marathon. We have to keep morale up for staff because morale is contagious. And let's say in a month or so we're up and operating, but your team's morale is poor, that will translate to families and to your registrants. So we need to understand that this is a long race that we're about to engage in rebuilding from this pandemic. Adjusting to new routine and challenges. We got to cultivate flexibility with staff. The way we've done things will probably not be the way we're doing them in the future. And there's always a resistance to change. I had a friend once tell me inertia is the most powerful force in the universe. And to get people to change and to adapt new habits and new routines, uh, don't underestimate how hard that will be. That's why leadership is a key. People, you have to work with folks to make sure they want to change. They understand the need for change. They understand the value in change, that there's creativity. And this is how we arise to the challenge, not by being fixed and rigid, but flexible and adapting ourselves to the future. And that'll be important. And you'll see that in your team, your team members, those who take to new changes, new routines, adapt, demonstrate creativity, and those who follow. They're not going to be necessarily the most creative. That's fine. Their strengths may be elsewhere. Not everybody is going to be able to do this. And you're going to have your leaders, your joiners, your participants, and then the followers. We need them all. And everybody brings different strengths to what needs to be done. It's your job as a leader to identify what those strengths are and cultivate those strengths and integrate those strengths into your team's routine. I think one thing that we all in the last few months began to recognize how our everyday routines have become heroic. It's just startling to understand and to watch, healthcare workers put on their protective equipment and go into a place where they are susceptible to, in some cases, what is a devastating disease, a devastating virus, and that they show up every day. I'll tell you a quick story. One of my psychologists was in a facility that was particularly heavily infected with COVID. And, there were a number of folks who were quite frightened about going into work. Some did, some took leave, some adjusted their work schedules. So one day I was reading in the news about this facility and how bad it was. And this particular psychologist called me and, I thought it was going to be bad news that, hey, I can't go in anymore. This is too dangerous. And she called and she said to me, Dr. Figlerski, listen, I have a request. And I was waiting to hear her say about going on unpaid leave. And she said, do you think it would be possible for me to do my documentation from home so I don't have to spend a lot of time in the building? And I smiled, because underlying that was such a dedication to her patients. And the only quarter she was asking was, can she do her documentation from home? So obviously I picked up on that and thanked her for her work and kind of, I'm not a priest, but I offered her a blessing in terms of her dedication to her staff. And I think we probably all encountered that. These folks mean something to us. They're important to us. We have relationships with their families, and we are willing to actually put ourselves in harm's way to deliver the necessary health care. And we do that every day. And I think what happens sometimes is when we do something every day, we kind of become anesthetized to it, we habituate to it. And I think as a leader, I think it's very important. I mean, you can certainly go over the top with that. So I want to be cautionary, but certainly in a meaningful and sincere way, I think it's very important to reassure your team and reassure your staff that the heroic nature of what they do is not lost upon you. It's not lost on the residents, and it's not lost upon the family members that you show up every day to take care of their loved ones. Now, there are some practical suggestions about sustainable leadership. And I think we need to, first of all, differentiate sustainable leadership from management. Management is an operational process. Management is about working through requirements. Management is about meeting goals. Management is about talking about efficiencies. Management, to some degree, is not very inspirational. How many of us love to be managed? I know I don't. I do it. I get along with it. I manage myself and I cooperate. Leadership brings a whole nother flavor to what we do. Implicit in the term leadership is that you're leading a group that are willing to follow you, that they are inspired to follow you, that you set objectives and you motivate people to achieve them. And that, I think, is key to keep in mind. So we want to start in terms of sustainable leadership is to get clarity about what our immediate, mid, and long-term goals are. Folks, if you can't say it in a sentence or two, what the challenge and what the goal is, rethink it. We don't get inspired by memos. We don't get inspired by procedures, by protocols. If I have to sit down and read a memo, I understand why I have to do it, but I'm certainly not necessarily inspired by it. Sustainable leadership and identifying challenges and talking about them is a personal process, interpersonal with the individual in front of you. When we have to get things done, we don't dump them on people, we delegate. We let them play leader. We let them engage as a leader for their team and what they need to do. So the idea that you clear your desk is a success is really off target. What we do is we delegate trust, and a part of that delegation involves tasks and things that need to be accomplished. But if you're a leader and you're delegating, implicit in that is that you're trusting the person. You need to be visible. You need to rally your staff. I can't tell you how important that is. You might be able to manage from a back office, but you can never lead. They have to know who they're following. And if you think about what we're asking them to do is manage a pandemic, manage a highly infectious virus, you need to be visible and you need to rally your staff and you need to be out there encouraging them. Monitor and set the direction. Let your staff deal with the details. Leadership is a mix of understanding the direction you need to go and motivating your staff and being able to state the rationale. It is not about getting bogged down in all the details. You're going to have to help the staff, but if you're dealing with too many details, you're going to be an ineffective leader. You need to delegate that and have your staff work with you to address those details. Again, simplicity is important. Avoid complicated responses. Keep things simple and as direct as possible. You are going to run into folks who bring up issues and problems. Receive them in a positive way. Reassure them there are going to be solutions, but you need to keep moving forward. And the best way to do that is to keep things as simple and as direct as possible. And I'll tell you from my experience over the years in both adult day healthcare and nursing homes and everywhere else, those environments hate complexity. The more complex, the more likely the interventions are going to fail. We want to keep things direct and as simple as possible. So on the right there on this sustainable leadership slide, something very quick and simple, keeping things simple, be present, be engaged, communicate, and most importantly, appreciate. Be present, be engaged, communicate, and appreciate. 4 core principles that are a part of sustainable leadership. So cultivating calm and focus. These last few months have been very anxiety producing, and my concern is that we're going to think that we're over the worst, and I have some concern that we're going to have this thing flare up again. And what that's going to do is bring back a lot of fears and anxieties from families, registrants, and staff. And they're once burned by this, so they're going to be very concerned and anxious about the reoccurrence, which I think in the back of our mind, we want to be able to anticipate and plan for. So as we move through this, You need to question as a good leader, are the expectations you put on your staff achievable? What are those expectations? We don't want to delegate failure. If you delegate failure or something that the staff can't be successful at, it's essentially what you're doing. You're delegating failure. You want to delegate. You want to keep the bar high. You want good performance from your staff, but you want to make sure in a fair assessment that your expectations are reasonable. Set the goals and the direction. And then the next important question for you is ask your staff what they need to be successful. In other words, in this delegation, your staff are responsible to get it done, but you're responsible to set the platform for success. And in that, ask your staff what they need to succeed. Create manageable challenges. I'm a big believer in small batches as opposed to flooding. Understand there'll be a lot in reopening. There'll be a lot of tasks. Break them down. Make them digestible pieces, because the sheer volume of work in and of itself can be a demoralizing experience. All right? Guide the staff to be present. And this is very important. This is particularly true when they're interacting with family members and they're going to be interacting with registrants. Sometimes we get so distracted because we're multitasking. We have so many things to do. And really what's lost is our focus on the here and now. And I think all of you listening probably know that experience, that you're dealing with somebody who's in front of you, but you know they're miles away. You don't feel that they're hearing you. They're not communicating well because they're distracted. They're thinking about the next 2 or 3 things they need to do. That is a sure way to lose the person in front of you. And that's a disaster if that's a registrant or a family member who's really assessing their trust of the program, the safety for their family member. You want to make sure they know that you're listening and you're there. So the idea here is, while there may be multi-responsibilities, at the moment you're dealing with a registrant and family member, or even a colleague and a peer, make them the most important person in the world. That relates to something I'll be talking about later, and that's winning back trust. If they don't think you've listened, if they think you're moving on to the next task, it's going to be very hard to instill a sense of trust. And that is going to be the operative term. Why am I going to go back to that program? They had people who had COVID-19. Oh, that nursing home that Adult Day Healthcare is affiliated with, they had a lot of people get sick. What are they going to do to protect me? Can I trust them? Those are going to be the issues you're dealing with in restarting these programs. What is the level of trust they can have in terms of their safety? Some other practical suggestions. While it's tempting to rely on your best person, your best people, don't over-rely just on a few key people. Develop a talent pool. Why is that? Well, two really main reasons in my thinking why you want to develop a talent pool. First of all, with relying on a few key people, you begin to risk burnout. In the beginning, there may be a lot of willingness, but remember, we're running a marathon here, not a sprint. So these few key people you might be relying on over and over and over again, they risk burnout. So you want to have other people. And in assigning and delegating other people that you're working with responsibilities, you get a chance for them to succeed, which is good for them, but you're developing a talent pool to rely on. Another reason, and this is based on what I've observed with this pandemic, is that this is a real pernicious virus. And what happens if you rely on a few key people and a few of those key people contract the virus and they become ill and they can't show up? So you want to spread out the responsibilities and develop talent and maybe tap people who you wouldn't think of in the past. we all hear the stories about how shorthanded operations became because a lot of key people became sick and were unavailable. So you can't just rely on one or two people. You got to think in broader terms. Am I developing a talent pool? When you look at your best person who helps you and assists you, in the back of your mind, just say, now, if they called in sick and they were going to be out for 3 weeks, 4 weeks, who would I go to next? Who could I rely on? If you come up with a name and a person, we'll start developing that person right now, delegating to them, make them feel a part of the team and contribute in important ways. Encourage your team to delegate. Again, I don't know how large some of your operations are. I understand some can be very small. So we're talking about a small staffing register. But if you have a larger group, if you have more people, you want them to start delegating. Teach them to delegate. Delegation is a real key skill in leadership. You delegate and you motivate. So you're not the only one delegating. If you have teams, have them assign tasks to people who report to them. If you really get into the heat again, just as we were a while back, people working double shifts, people working extended period with no relief. I know all your operations sometimes are different. Some run 6 days, 7 days a week. Some have morning and evening programs, and you're relying on staff who do doubles. Be aware of burnout. A burned out staff member is of no use. And in fact, what happens with burnout is they're going to be likely to make mistakes, and we want to minimize that. So schedule relief periods, make sure you're sensitive to it. That doesn't mean everybody isn't going to be contributing and working hard, but we do need relief periods, particularly if you're in a long run with no breaks. You may need to reestablish the definition of what a good job is. I say that in very broad terms, but what was a good job in February may not be a good job in July. And by good job, I mean good work, what you've accomplished. What is a good job? What do you thank people for? When have they been successful? This pandemic and what's happened is really redefined our whole notion of our operation and what needs to be achieved. So with that, we need to think about what is good performance, redefining that. Have regular discussions with your staff to acknowledge them and bring them positive news. I'm sorry for the typo. Acknowledge them, not there. Make sure you bring them positive news. I'm not telling you that you're going to be a cheerleader, but to some degree you are. You got to keep your staff's morale up. I call it, in a nursing home, I call it appreciation tours, but I would say the same thing in terms of your adult day healthcare programs. Do appreciation tours. Be visible. This is about communicating. And in these appreciation tours and talking with your staff, make sure it's all positive news. This is not, that's a really good job, but bring positive news, appreciate them, be visible, show it in your mood. Listen, as a leader, people watch you. And if you come in and you're having a bad day and you let everyone know you're having a bad day, if your facial expression shows you're having a real bad day, if your responses show you're having a real bad day, guess what? Pretty soon your staff is going to have a real bad day. So we want to go in positive. That might be just a face you have to put on as a leader, but it's an important one. And that's why you need to bring positive news. When you do these appreciation tours, it's not about being critical. That doesn't mean you're not going to see problems, but make a mental note, deal with those problems later. Don't mix an appreciation tour with criticism. Keep it pure. All right. You're going to have staff who've gone through a lot. They're challenged by this. They're anxious. People can lose their perspective. This is where, as a leader, you need to help them keep it. And that means you have to keep your perspective. We're going to get through this. I have no doubt. We're going to make adjustments. We've been through challenges like this before. I mean, every generation feels what they faced with is the worst possible event. And the reality is generation upon generation upon generation has been challenged in terrible ways and demanding ways. And we arise to the challenge. And it comes with a optimism. It comes with working as a team. It comes with a perspective that we try to foster among our teammates, among our families even. So we need to help maintain that. So we'll get through this. And when you say that to your staff, you need to convey that and make sure they believe this. And it's the truth. You know, it's an easy sell when you're selling the truth. Best practices to foster among staff. This is very important. And, you know, remember, your staff are interacting with your registrants and families, and how they interact is really representing your program. So what you want to foster as a leader, you want to foster kindness and compassion. You want to demonstrate that by having kindness and compassion towards your staff. Leadership and management sometimes take on different roles and different styles. But right now, with these challenges and the anxieties and the fears, I think from my point of view, kindness and compassion are the most important. Reassurance, very important. You establish a powerful leadership role, your reassurance means a great deal. So you want to foster that among your staff so they demonstrate that with families and registrants. Present challenges and responsibilities with confidence and optimism. I think that's key. You know, we have to be optimistic in dealing with this crisis. We have to be upbeat. We can't be defeated. We can't foster confidence in what we do if we do it with a pessimism and a negativity. Do an inventory and ask your staff to do their own inventory. Recognize your own strengths and weaknesses. One person is not good at everything. They have their strengths and they have their weaknesses, and that's not being critical of them. People are better at certain things than they are others. But it's really now, and particularly in this time of reopening, for you as a leader to identify your own personal strengths and weaknesses, and also your staff's, and help them recognize what their strengths and weaknesses were. Now, does that mean we just accept the weaknesses and the deficiencies? No, we coach them to do better. Some people can do that, some people can't. But that doesn't necessarily disqualify them from the position or the work they're doing. It might just mean you have to address the assigned work. And again, I'll give you a quick example. You know someone on your staff who you have such confidence in when they reach out and they call a family, right? You know who that person is. If you had to have one person to make a call to a family member about something, you know who you want to have that, who do that. And then you also have in your mind, they may be a great staff member, they may be hardworking, they may be a lot of things, but you know, that's the person you probably don't want to have and call the family. Maybe you can help develop that skill set. Maybe it's more natural, maybe it's just their personality. But think about strengths and weaknesses. Recognize what you can and can't control, and help other people do the same. You know, too often we just feel that if we work hard, we're going to be successful. And that is true. I mean, hard work is a part of success, but there are factors out of our control. And I think it's important that we don't dwell on it. We don't become frightened about it. We understand what's in our control. And then we go on with our day and do the best we can around what we can influence and control. People sometimes merge the two. And by what I mean by that is if there's things that are frustrating them that they feel out of control with, their conclusion is, oh, what the hell? Why even bother? And what they begin to ignore are the things they really can have a palpable, powerful influence on, what they can influence and control. So simply stated, they throw the baby out with the bathwater. Just because some things are out of control doesn't mean everything is out of control. And to position yourself and to let staff know that and continue to do a good job around those things they can control really is a compliment to your program, and really is why some programs will survive. But again, not everything can be controlled, and sometimes we have to accept that. Keep things simple. And by that I mean you want to really highlight important behaviors that your staff should be practicing, registrants should be practicing, and focus on consistency. I call it consistency of best practices. This is going to be very important, and this is going to take a lot of training before you open your doors. I mean, I'm not going to go into infectious disease processes because I think to some degree they're changing a lot right now, how this virus acts, what we need to do to protect ourselves. But some of the basics are going to still be there in terms of infectious disease and how we manage it. And we want that to be crystal clear with your staff. We want to rehearse it. We want to test it. We want the smartest people in your facility, in your program, who understand infectious disease to really teach. Do that by modeling, do that by routine. And what I call then is consistency of best practices. Those behaviors you identify need to be practiced well and accomplished well every day. And that should be rote, that should be routine, whether it be wearing a face mask, whether it be changing gloves, whether it be how you handle sanitation, whether it's involving cleaning areas. You know, those are going to be really key practices, and I think will differentiate programs that are going to be successful in opening up and those who aren't. So think about that as a term, consistency of best practices, all right? In the short term, you might want to develop a mission statement for your team. Many of you do have mission statements. Oftentimes these mission statements hang on our wall and they kind of just get forgotten, you know, or they're written down and that paper turns yellow. We might want to refresh our mission statement about what we're doing, and God knows you guys have a great platform for a mission statement in terms of your service, in terms of what you're trying to accomplish with a vulnerable population, what the outcome is. What the outcome is, if you're successful with these folks, is just extraordinary. So you have a core here. Keep the mission statement simple and direct, but as a leader, to refocus your team, to talk about why it is you do what you do, a mission statement can become invaluable. Burnout. This is a real thing. Prior to this, you know, looking at some studies, they talk about burnout among healthcare professionals at somewhere around 50%. And that's due to a lot of reasons. I'm sure it's much higher now post-COVID. There's an article there. This was in the National Geographic. I gave you the citation. It goes through the struggles of a nurse and the unrelenting pressures of the front lines about what her experience was. And I think it really is worth a read. You really want to avoid burnout. Once a staff member is burned out, it's very hard to rehabilitate and reclaim them as an effective worker. Burnout is a state of mind that is very, very hard to undo. And the experience from that worker's point of view is one of detachment and numb, feeling overwhelmed and inadequate, isolated and alone, angry and cynical and exhausted. This is from overwork, but oftentimes these feelings are because we're assigning tasks incorrectly. We're giving a few people too much work. Maybe we're giving people work that they can't be successful at. Maybe we're not providing the resources we need. Maybe they don't have a definition of what a good job is in terms of the tasks they're being assigned. Maybe it's that their leadership, their program director, is never there. And maybe it's when the program director comes by, all they do is criticize. You see, the foundation of the presentation of the first 5 or 6 slides, you can see where the suggestions tap right in to avoiding this experience, to avoid instilling this experience in your team members. Because once this takes hold and you have a few team members who experience this burnout, this feeling of powerlessness, it's going to be very hard to keep your team together. All right? So these principles are very important. Again, I'm a big believer. Your team, the people on your team, are not dispensable. I've worked in healthcare for many, many years, and unfortunately, one of the experiences I've had that leaves a terrible taste in my mouth is when dedicated health professionals are treated as dispensable pieces of equipment by administration. It's a terrible feeling. We went into healthcare to help. We're there because it's in our nature to want to assist and want to help. And we want to make sure everyone experiences that as a valuable endeavor. We have to be mindful of that. People are not dispensable objects. We need to make them feel valuable and as a part of our team. So if you do begin to experience this or see burnout in folks, you're going to see signs. It's almost impossible to miss. We may be in denial. We may not want to see it. We may ignore it. But if you're looking with a keen eye as a leader, it's very easy to see. You're going to see depression and anxiety in your staff. You're going to see absenteeism. You're going to see people resign. You're going to have angry outbursts, conflicts, errors. Because if you're burned out, you care less. Your mind is not acute as it was in the past. You're going to make mistakes. You're going to forget things. People are going to be walking around in a state of despair. On a personal note, as people burn out, become numb, become overwhelmed by their work, issues of substance abuse become an issue. Now you have an impaired provider. And then finally, and I think we're all clearly aware of this, suicide. Suicide among healthcare workers is not a small item. It is pretty common, and I think we saw an example of one of the doctors during this crisis in New York City committed suicide, overwhelmed and despairing. This is really something in a leadership position where you really have to toughen yourself to be able to be a good leader, to be able to address these issues, to be able to talk candidly about them, to be able to identify perhaps staff that are burning out and have heart-to-heart discussions with them about what their expectations are, what the problems are. And then finally, if it really gets bad, to identify those who are impaired and direct them to the help that they need. These are going to be the realities, particularly if this COVID-19 virus continues to be as difficult and resistant as we fear. If you're confronted by your staff or confronted by an individual on your staff or a person who you're working with and they're angry, understand where usually anger comes from. It's about a feeling of being powerless around circumstances. Usually with powerlessness, there comes a frustration. Perceiving you are being taken advantage of or underappreciated. That you're tired. You're fatigued. And none of us are at our best when we're tired. Or that you feel poorly supported. I get asked to do all these things, but no one gives me what I need to be successful. No one cares. They just dump this on my desk. People begin to get angry. And unfortunately, it's a human quality that when people begin to feel injured and angry, they tend to nurse that anger. It tends to grow. They begin to lose perspective. They're always on a low simmer. And if that does erupt and you have to deal with it, you have to recognize your response. As a leader, understand leadership is often confused with the military. Generals in the military have a great advantage. They can order people taken out and be shot. They can get arrested. In our situation, we can't do that, and nor should we. So your response is not to be rigid and focused or rigid and inflexible. It's to really diffuse the situation. Help the person be empowered. Listen. Be aware of your demeanor. And that's sometimes harder to do than we think, right? To be confronted by someone who's really angry and to manage your demeanor and tone, can be a real challenge because we're going to get defensive. We're going to explain the policy. We're going to explain the procedure. We're going to go back to our protocols as opposed to listening. We have to be concerned. And this is where you have to tap into your healthcare provider, your humanity, your humanness to be able to listen. Oftentimes their concerns are valid. There's nothing wrong with validating their concerns. I think there's something, it's the last item, and it's worth mentioning now. You have to remind yourself that listening is not agreeing, okay? Listening is not agreeing. You can listen to somebody, and sometimes just listening to some of your staff, if they're frustrated and angry, is diffusing. They needed to vent. Now, this is where you have to be genuine in your response. You'll be able to help in some cases, you won't in others. But you want to open up and have a genuine communication. You want to validate their concerns, understand their concerns, and even then, you may not be able to resolve their concerns, but you can acknowledge them. So remember that last one. Remember, listening is not agreeing. We've been confronted with a great deal of trauma and in many cases, death. I don't think there's anyone I know in the healthcare business right now and doing these programs in nursing homes who isn't intimately familiar or certainly familiar, at least at arm's length, with someone who's contracted this virus, who's been terribly affected by the virus or has died from the virus. That can be on a professional level in terms of your role as a healthcare provider. It could be on a personal level. This really took us by surprise. And I think the best way to recognize that is that we're doing daily death counts in New York State. And we're monitoring who's contracting, who's dying. That's a hell of a report, right? If you think about it professionally, we tend to habituate sometimes to these kind of things. We harden ourselves. But if you do take a step back and realize we're getting daily mortality reports, that's kind of overwhelming and frightening and brings up conversations that we need to have or be prepared to have with our staff, with families, and with our registrants. We can't shy away from this. This information is out there. They're seeing it. What we can do, though, is to be able to be open to talk about this, to help model how to understand it and shape it, to be able to listen to people who need to talk about it. And we can be an active participant in dealing with trauma and death. So we're going to go in through a few slides. I hope some of this helps. These are tough topics. We all have our own personality styles, our own experience, our own professional experience in dealing with these kind of things. And I hope that this helps you take it a step further. So when it comes to trauma, let's start by talking about PTSD. This is a real condition, and not everybody who's gone through this COVID experience is going to be developing PTSD. But generally in the guidelines and rules and regulations and professional standards of the folks we take care of, our question needs to be, who is demonstrating these symptoms, or who would likely, or who might likely be exposed? Who is at risk? You know, it's this issue of risk. So when you think about what just happened to our families and to our registrants in our operation, they very quickly were isolated, lost resources, were cut off from support, friends. These programs mean a great deal to registrants. And for them not to be able to participate, to see a friendly face, to get the support, really begins to raise the specter of mortality, vulnerability, increases anxiety. And now we have this incredible period, particularly for many of the registrants. I mean, getting out to your program a few days a week or 5 days a week or whatever it was a highlight for their week. And now they may not have been, in some cases, they may not have been out of their apartment or their home for extended periods of time. So that's just the first aspect of this effect of COVID in terms of restrictions and isolations. Now let's take it the next step. Did they get sick with COVID? The next step, did their family member or someone they know become sick, affected, or died? There's such a thing as vicarious trauma. It raises your sense of vulnerability. So there are going to be folks who have been traumatized, and we need to keep that in mind. Now, typically when we think about PTSD, most common way we think about it is warfare or some kind of physical event. But events that lead to PTSD are much more common than we think, and it's surprising. So let's think about situations like flooding, right? Hurricanes, fires. All three of those things have affected the healthcare system over the last 2 years. Down in Florida, I'm sure, and down in Texas, I'm sure you all had seen pictures of residents of nursing homes who were sitting in wheelchairs, covered in water up to their hips. The wildfires out in California, that they had to evacuate facilities and programs, nursing homes. So now we have another, traumatic kind of national event where you can catch a virus that's airborne, that is something that kind of, that's hard to protect yourself from because there's no clear understanding necessarily on how to do that. You can only take precautions. So this is another quite powerful anxiety producer and potentially traumatic event. So we have warfare and exposure, criminal assault, violent physical, sexual assault, witnessing violent attacks, witness of parental suicide, as we said, house fire, earthquakes, childhood physical abuse, sexual abuse as a child. Now remember, some of your registrants may have already been previously traumatized. So it's not that this event is their first trauma. This could be something that re-traumatizes, and I'll talk about that in a few minutes. A life-threatening diagnosis, I think COVID-19, from what we understand, might qualify for that. I mean, I know there's people who really get COVID light, so to speak. I say that my dad is in a nursing home, and he contracted COVID, but he was lucky. He's one of those few people, or one of those people who had a mild fever a few nights and a cough, and he was on the other side of it, and he's fine. I know other people much younger than him, athletic, who ended up on a ventilator, double pneumonia. So this is a very kind of mysterious and difficult virus to understand in terms of its effect. And then I'll go back to the secondary or vicarious trauma, that you could be traumatized by knowing of somebody or seeing somebody who has become ill. So I think this virus and its impact certainly qualify as a potentially traumatic event for our registrants. And it doesn't mean, again, everybody is going to develop PTSD. Not only that, some people may not have been affected. I mean, we have to really keep our perspective that there are groups of people who are affected, and there'll be others who were really unaffected by this. They were more witnesses and looked at it at a distance rather than something that affected them personally. So with that, we need to talk about acute versus chronic trauma symptoms. Trauma reactions are normal when people have been exposed to harsh, difficult events. acute trauma reactions are normal. They last a few weeks to a few months. People generally in the very beginning become very they adapt, they become vigilant. And again, you can tap into your own personal experience. What I've noticed over time with this COVID-19 is in the very beginning, the masks, the gloves, social distancing, people were very adherent to it. And I think then over time, they began to do their own personal risk assessments, which is very valid. Everybody has their own level of risk and what they see as a risk. So now their anxiety levels are lower, and for good or bad, their protective habits are now being reduced. They're wearing the mask less, they're not gloving up anymore in their daily routine. So their anxiety is going down, which may be fine. I mean, I'm not making any predictions of the outcome, but the point is that people begin to adapt, people begin to make adjustments, and that'll be important. And interestingly here, this relates to your staff, and where your staff may in their personal lives begin to become less vigilant around this COVID-19. That behavior in your nursing or in your program, in your adult day healthcare program, is really not acceptable. And in fact, we might want to talk to our staff about practicing good personal protective habits when they're not in your program. Because again, if they are out in the community and they're not practicing good health behaviors, protective health behaviors, and then they come into your program to work, well, they may be bringing in that virus. I know you'll probably be doing screenings, but I think it's very important to let your team know that their personal behaviors when it comes to this COVID-19 virus are as important as their daily practices at work. Okay? So this acute stress reaction does resolve over time. People do begin to revert back to the normal, and they become less anxious. They're less symptomatic. When people are exposed for a prolonged period of time, and this is something to think about because I don't know what the window of exposure here is going to be in terms of this COVID-19. My guess is it's going to be a quite extended period of time that we're dealing with this, where their reactions and their anxieties can be reinforced. If you're anything like me, you feel like you've been living through a Twilight Zone episode with watching everybody in masks and walking around. I mean, in the very beginning, I saw someone in a grocery store actually in a hazmat suit. And I understand that was that person's personal risk assessment, but it really kind of freaked me out. It really did feel like a Twilight Zone episode. So these chronic threats, chronic stressors, can really elevate people's level of anxiety over an extended period of time. So people's trauma reactions may be surprisingly extended over time. And that's the issue. Prolonged exposure to trauma, to a stressor, is the beginning stage of a PTSD reaction. So it'll be just something we have to be able to be talking about and monitoring. And again, not everybody is going to have this reaction. We have to look at our group, understand our registrants, and their reactions. So I guess I want to say that because as healthcare providers, and particularly if you're in a leadership role, if you anticipate and think everyone's going to have PTSD, that'll be your message. That'll be your concern. And all of a sudden, everybody's going to have it. Not everybody develops PTSD. People are going to be inconvenienced. Don't misinterpret discomfort or anxiety with a traumatic reaction. We're going to have to sort through and ask good questions. And there are screening tools. We don't have to make this conclusion all at once with our registrants. It may take a couple times, a couple visits. It may take time to work with them to begin to see how they've been affected by this. If you do have folks who are demonstrating post-traumatic stress disorder, I think it's very important for your staff to know this is not just them being difficult. This is a person being symptomatic. True PTSD is a neurological, physiological, psychological disorder. And I put that there together because this is not someone just being anxious. This is in someone's head. PTSD is neurologically, people with PTSD are hardwired for these reactions, and it is unbound to time and circumstances. That's going to be true of your staff. Perhaps they contracted this. Maybe they've had a severe health issue related to COVID. Perhaps they had other traumatic events where this COVID episode has exacerbated their anxiety. It is important that your staff, and this is a message to take home, it is not your registrants or even your staff being difficult. It is them being symptomatic. And symptomatic of what? Symptomatic of PTSD, the anxiety, the avoidance, and it's very important so we can talk about this in constructive ways. So this was a study done in the military, and I shared this slide with you because of what were common trauma exposures. And I share this for this reason. A friend seriously injured or death. You know, and you begin to look at that and realize that this COVID-19 pandemic may create experiences for our families and registrants and staff that someone they know was seriously injured or died, okay? A witnessed an accident, death, or injury. That certainly is possible with this COVID-19. Smelling decomposed bodies, well, that might not be true in adult day healthcare programs, but believe me, in nursing homes, that was an issue, knowing that they were storing and holding dead bodies because it just the amount of mortality and death and being able to process them out and get them to the right locations in funeral homes and coroner pickups. Hospitalization, injury. So again, while this was a military study that was done by the RAND Corporation, if you look at the top 3 or 4 items, these were experiences that happened in our community. So again, the risk of trauma and trauma reactions is real. Okay, so once I did, you know, some of the studies right now, they're just getting published in the new, but I did come across a study in terms of the meta-analysis of post-illness stages of the coronavirus family, and this was SARS and MERS, and they looked at a number of studies. So post-traumatic stress disorder, 32% of the cases of people affected by this coronavirus family, SARS and MERS, developed PTSD. 15% depression and another 15% with anxiety. The article was in Lancet, the site is there. So it really does tell you that this illness, this SARS, MERS, and this coronavirus family, in this case COVID-19, can have real powerful psychological impact after recovery. You know, the one thing I mentioned later, but I'll also mention now, is let's say over the next month or so, this COVID-19 gets more manageable. And by the end of the summer, we feel we have a handle on it. What do we know as healthcare professionals come the fall? What we know is that it's flu season. So what, you know, more powerful trigger to raise anxieties, even if COVID-19 is being better managed, we're going to be walking into flu season. And you can imagine the anxiety and fears that it's going to be able to produce, it's going to produce in your registrants about contracting the flu. You know, someone has the flu, the question is, well, is it COVID? Do they got COVID? Are they sick? Am I going to get sick? So I think we're going to be looking at the flu in a whole nother way come the fall. So it's probably one of the more sad and uncomfortable aspects of healthcare workers' jobs is dealing and handling death. We certainly do need to have kind of professional exterior and way of managing it and responding. But we also can't lose sight of our humanity and dealing with this. And we need to understand one aspect. How we deal with death and how we model and our reactions is what registrants. I'm not talking about your own personal life. I'm talking about your role in a program, how they deal with it. They're going to observe how you deal with it. You're a model in that sense of how you acknowledge and deal with it, whether it's a taboo topic, whether it's a secret. I do recognize there are going to be some HIPAA concerns. I'll mention that later. And we need to brush up on HIPAA. I'll talk about that later. But we do have to acknowledge and deal with what's happened and what could happen in the future. So we need to acknowledge deaths when they occur. We need to create in our community an opportunity to listen and discuss them. And that's not only for the grief they might experience for the person who expired, but also, how will I be talked about if I die? How will I be remembered? How important am I to this community? So every time we acknowledge a death, it also serves as an example of how we handle our family member, how we handle our registrants and members of this community. We can validate. There's no one way to react to death. Everyone is unique in that sense. So we do not want to be judgmental. We want to validate feelings and be reassuring. I think it's important. We want to tolerate sadness and grief. We want to create opportunities to express that, to be accepting of it. And as a staff, we need to work with everybody in terms of our peers, our staffs, our colleagues, to be able to tolerate the sadness and grief. And the way we do that is by looking introspectively about how we feel about death. This is a shared journey we have with everyone. None of us are in this forever. None of us get out of this alive. So our dealing with death, our feelings about death, how we look at our own mortality, probably not a bad conversation to have with ourselves and think about it, so we are prepared when we see others experiencing it. Do we get uncomfortable? Do we not like to talk about it? People will pick up on those feelings. We can use it to drive home a message, which is not bad. Emphasize how best practices will minimize loss. I go back to consistency of best practices. This is in terms of a leadership role, how we communicate to our staff. If we are concerned about dealing and minimizing mortalities, illness, death, well, one of the best ways is to follow the practices and guidelines we've set out. And set up a process that handles death in the most respectful manner possible. Now, I hope we're not going into the future where this is going to have to be such a common process that we have to set up protocols and procedures. But I do think as a leader, we need to think about this. If a number of your registrants become ill or expire, or staff members contract this and expire, or in your community, if you're attached to a nursing home, there are deaths. We need to think about this because, your program is going to be associated with that. So we have to be transparent, we have to be realistic, and we have to be able to have these conversations in a way that can be reassuring and helpful to family members and to registrants. Another message here, and this is particularly true with your staff. You could have a great staff doing everything right, but understand it is still possible to have an adverse outcome. Sometimes we just feel that if we do everything right, everything will be all right. But when we all take a step back, we realize that's not the real world. It is certainly possible to do everything right, but still have a bad outcome. And that's just life. And that's something we need to let staff know. We want them to put forth their best efforts. We want to build a team that's resilient. But even the most winning team has a loss now and then. and there may be nothing that can be done about that. How we respond to that loss is something we do have control over and something leadership needs to keep in mind. Now, there's an important concept, and I think that this is a good, sorry, there we go. There is an important concept that's in the literature, and I'm always fascinated by this because as a caretaker, and certainly in the medical community, we always think about injury, loss, tending to injury, tending to illness, tending to the patient. So we begin to look at the patient as being vulnerable. But what we're learning is that in fact, the vast majority of people, as they go through adverse experiences and trauma, in some ways grow from that. Viktor Frankl wrote about this, for any of you familiar with him, A Man's Search for Meaning. There was his experience in Nazi Germany in the camps, and he was an analyst back then, and he ended up a psychiatrist, and he ended up concluding in Man's Search for Meaning that in some ways suffering ceases to be suffering at the moment that it finds meaning. And believe me, I've been thinking about this a lot in terms of healthcare workers and how their mettle has really been tested, and they've been exposed to really some very challenging, difficult circumstances. But that's not only true for healthcare workers, it's true for our registrants, it's true for their families, that this challenging situation that we've all been through can lead to growth. And certainly, you know, and I know some of you might be rolling your eyes and saying, oh, what is Bob saying? Is he saying when you're given lemons, make lemonade? No, I'm not. And believe me, people who've gone through these traumatic events and on the other end of it realized how much have they grown, none of them choose to have the suffering. They would prefer to be as they were and avoid the suffering. But suffering sometimes is a part of life, but we can find meaning in it, and from that grows. So post-traumatic growth is a real concept. It's different from recovery. It's resilience. It's about bouncing back stronger. Through challenges and suffering, in some ways, there comes growth. And you think about it in terms of the human system, as we challenge ourselves physically, we grow stronger. I mean, I think of the simplistic kind of example, and if you want to build muscle and physical toughness, oftentimes you lift weights, and what you're doing is tasking your body to grow. It becomes stronger. Well, you know, I think that concept applies sometimes psychologically, that as we test ourselves emotionally and psychologically, and we go through this, we become stronger. Resilience is a common result of trauma. This is not the exception. And there are multiple pathways to resilience. Sometimes it's religious belief, counting on family, counting on community, culture, that people find different meanings. Understand with this, when we talk about finding meaning in this, your meaning may not be someone else's. Someone's meaning that they attach to what they've gone through, how they understand they survived it, how they understand and got through what they see as their strengths. All of this is very unique to the individual. Some of the signs of post-traumatic growth: there becomes a greater appreciation of life, strengthening of close relationships, increased compassion and altruism, recognize new possibilities and purposes in life. I am absolutely sure on that one, new possibilities and purposes in life. For many people who've been on the front lines dealing with this COVID-19, that there are many of them doing a real reassessment of how they're living their life, what their professional life means, what's really of value. Enhanced spirituality and enhanced creativity. So there are some real positive outcomes. And again, I just want to say, when you interview people who identify themselves as going through post-traumatic growth, none of them say, oh, thank goodness this horrible thing happened to me. They much prefer that it didn't happen and they were left alone and that they were the same. But again, we can't pick and choose our suffering sometimes, Our suffering finds us by terrible events out of our control. Well, we can't control that, but what we can control is our response to it. Now, I'm sharing this with you because I don't want you all to underestimate the resilience of your registrants. I want you to think about it in terms of their capability and their ability to grow. And I think that's important because if we treat them as injured, if our expectation is that they are vulnerable and unable, in many cases, we are going to be selling them short in terms of their capabilities. So look at every one of your registrants and families as they return the program with a fresh look. Be able to have these conversations, not with the expectation that they've been traumatized, but with the curiosity of how they're responding. Those folks who are traumatized, you'll know pretty quickly. Those folks who are unaffected, you'll recognize pretty quickly. And those folks who may have gone through an experience where they feel they're growing and coming out of it better, you'll be able to recognize. As a healthcare provider, and particularly in this case a psychologist, I don't want to take for granted how everybody responds. I don't want to pigeonhole them in terms of how they respond. I want to be open to the idea that each is an individual and will respond in their own way. Now, for purposes of today's presentation, I'm not going into great detail with this, but I do want to point this out as a resource to you. As you know, or maybe you don't know, but beginning in November of 2019, nursing homes were asked to screen all new admissions for trauma and to establish what they call a trauma-informed approach to care. And this is something, a document that SAMHSA came out with, and the website is there, about the 4 R's of establishing a trauma-informed care facility, or in this case, program. And the steps are straightforward. As I said, we don't have a lot of time to go into detail in this, but I'm putting this in as a resource for you. And that is the 4 R's: realization, recognizing, and it's a part of what we're doing today, recognizing and realizing that trauma takes place in the community, which means that people from the community who participate in your program may have experienced trauma. Recognizing signs and symptoms of trauma. 3, how, as a team, you work with staff of how to respond to trauma. Reassurance and validation and recognition of that. And finally, the most important, to make sure we understand our registrants and resist re-traumatization. It's one of the main fundamental building blocks of establishing trauma-informed care. It's recognizing and resisting re-traumatization of the resident. And that'll be, again, unique to each person, but we're dealing with individuals, and we'll learn about our registrants and how we can avoid that. So again, not enough time to go into this in great detail. This is a great pamphlet. I say it's a pamphlet, it's about 40 pages long, but it talks about these ideas. And while your program may not be able to adapt everything they talk about, certainly there'll be good ideas there for you to review and read through. So the aftermath, we're going to be winding up the presentation in a few more slides. These are just some general ideas, and I want you to keep this in mind. Increased family and caregiver stress. Nearly 1 out of every 4 households is involved in providing care to a person 50 and plus. It's probably one of the most important relief mechanisms your program provides, that family members know their loved one is getting good care, and it gives them some relief in terms of what their routine is. 5.8 to 7 million people provide care to someone 65. Hold on. 5.6 to 7 million people provide some care to persons 65 or plus, and this is where we really fill and meet needs. The average age of caregivers are 46, 50 plus in some cases. 75% of those providing care to older family members are friends and are female. 25% of all workers provide elder care, 65 plus. 52% of all care providers or persons 50 are full-time work. These are why your programs really meet a need to enhance the quality of life of your registrants. So please understand this. This is very important, and why your programs are so needed and why we need to get them open. Understand families are going to be anxious, and to some degree, they play a very important role. They can be customers, they can be advocates for their loved ones, they're partners in developing and implementing care. We certainly know that. They're watchdogs, they're potential referral sources, and in worst case outcomes, they're potential legal adversaries. So families play a lot of different roles. And as in running programs, we need to be very sensitive to that. And here's what they're influenced by. I don't know if any of you are in my situation, but I am just so tired of watching the news right now. The media, news reports, sometimes it's confusing, oftentimes it's sensational. I think back to an old saying, if it bleeds, it leads. We're being flooded with anxiety-producing news that stoke our fears. Public's negative perceptions or stigmas regarding sickness, aging, and health, their own attitudes. There is real loss of control in these situations. We have to be sensitive to that, and oftentimes the family's own anxiety, guilt, and fear. And you know from your experience that the family members range in their reactions can cover a lot of territory. You have some families who are calm and collected and work as good partners. You have other families that can be very anxious and demanding. You know, we need to give them all respect and understand what drives it. But here's what's in our control. We can shape their experience with your staff. How your staff handle them, how your staff responds, that's what we do have control over. We're not going to be able to change the media or where people get their news or the next report. But what we can do is work with our staff so they are sensitive to the families and how they respond. I'm venturing off a little bit out of my territory, but I think it is important to keep in mind. So we give honest messages in marketing and doing your education. We can't eliminate all risk. We can minimize it. And I think that's very important from a psychological point of view. You know, family members want their loved one to be safe, but I think we need to set the expectations in a reasonable level that we're doing everything to minimize risk as opposed to eliminate risk. How will you communicate and educate your families and registrants? I have to tell you, I think I mentioned earlier, my dad is in a nursing home. He did contract COVID, but I'm dealing with this particular group where he is at, and they've been wonderful. I get pretty much daily updates on the situation in terms of illness and who has it. They don't sugarcoat it. They have regular meetings. I'm assigned a person. I have a personal person there, or personally, a personal person. That's a heck of a way of saying it. I have a staff member assigned to me personally who I can call if I have any concerns. So they're handling groups and cohorts. So I feel very connected to what's happening at that facility. And, you know, this might be take some time in developing, but, you know, we do want to open up lines of communication in families beyond what we probably did in the past, because there are going to be anxieties. I think it's very important in terms of your staff that we do a brush up on HIPAA, because there will be demands placed on your staff for information, and they're going to have to be pretty clear in their mind what they can talk about and what they can't. And certainly I think one of the things is, if you're not sure, don't talk about it. If you're not sure, don't share it. Find out and then share it if appropriate. Because once you violate HIPAA, you violate HIPAA. So we really need to brush up and have our staff familiar with what the guidelines are and get them into that routine. So this is a big part of this. Increased communication comes with the risk of increased HIPAA violations. So we really want to make sure our people are experts on that. Thinking ahead, acknowledge the process will be about adapting, not returning to the old normal. This is, to some way, you know, not minimizing what we've been through, creative destruction. Think about how you want your program to look in the future. Some of you have been now shut down, or all of you have been shut down for quite a while. As you reopen, is this an opportunity to accomplish some of the goals and some of the vision that you had that could not be realized in the past? Honest discussions with your team about what happened. This is very important. I will make a cautionary note. As a leader, I want to start doing that individually, okay? I say that because you want to get your finger on the pulse of your team. You want to know the issues. You want to get versed in the issues. Simply having a big meeting with everybody to talk about their experiences risks losing control. And you do want to have control over this, because you want to make these discussions productive. You do want to understand each and every member of your team's experience and opinion. And as you become more familiar with it, that's when you begin to establish group meetings with an agenda. Don't run meetings without an agenda. You need to have the topic. You need to have a purpose. Otherwise, what you're going to do is have venting sessions, which are counterproductive. Venting is something we do personally, we do individually. And if you have to have group meetings to vent, you've missed it. Individuals vent, right? That's what you want to do. You want to find people who need to talk to you. You don't want to create a group opportunity for that to coalesce around negativity. Because again, team members sometimes will drive the negativity, and you don't want to set a stage and a platform for them to do that. So get to know your team, spend time talking with them individually, knowing where they're coming from, very important. Thinking ahead, post-traumatic stress disorder versus post-traumatic growth. Again, not everybody is going to be affected in the same way. Oops, I'm hitting the wrong button, sorry. To get started, once you begin to bring your team together, have regular debriefing sessions, all right? By debriefing events, have topics, debrief what's going on, rebuilding happens in stages. It's going to be very overwhelming to reopen. You're going to be getting new requirements. You're going to be getting new information. Keep your cool. Leadership is about vision, keeping your cool, leading with confidence, and letting your staff know that this is not going to happen overnight. Rebuilding happens in stages. Emphasis on team building and making sure your team's morale is high and that you convey enthusiasm. Some practical suggestions. There's been a lot of recent trauma, as we talked about, isolation, separation from family, extended period of risk and threat. When we're starting, we want to rescreen right? We want to get to know our registrants. Issues of personal illness, perhaps deterioration in health, even separate from COVID, all right? These folks have been counting on you for a lot of healthcare and support. We want to make sure we're current with their physical conditions. To some degree, with a 3-4 month hiatus, every registered, even if you've known them for years, is a new registrant. So keep that in mind. Knowing someone who was ill or died, that's a potential traumatic event for them. Increased fears about personal safety. I'm coming out of my house. I know all this about COVID. Am I safe to come to your program? Make sure you have a message for them about their safety. Make sure you can be reassuring about how you're going to ensure. And again, as I said, I think we're going to be looking at flu season in a completely different way. It's certainly that something can re-traumatize people and fears that COVID might be back. Remember, anxiety is real, but it's not rational. People who are anxious are not necessarily rational at the moment. Anxiety drives their reactions. So again, we want to reassure and address the anxiety and support, but don't be surprised sometimes if their fears are exaggerated. Some other plans for the future. Establish telemedicine protocols as a plan to future responses and restrictions and reoccurrences. Guys, what I can tell you in my experience with telemedicine right now, we weren't doing it. We weren't doing it for a variety of reasons. One reason is that it was restricted to provider shortage areas. That's what they call it, provider shortage areas, which had zip codes. So depending on where you were in New York, you may or may not have access to it. Now that they've lifted the restrictions, I'm not sure if they're going to go back in place on the other end of this, but certainly it seems like a reasonable response if there will be future shutdowns. It is complicated to establish a good telemedicine program. This is not about your psychiatrist or your psychologist or the doctor just getting on the phone with somebody. So think about telemedicine, maybe as an alternative if some restrictions happen in the future. Right now, though, the rollout of it during a crisis, as you would expect, has been terrible. Why? Because how do you establish a new program in the middle of a crisis? It's like, putting in fire alarms while your house is on fire. These are things that need to be thought out prior and established as a go-to protocol, not something you just implement in the middle of the situation, the middle of the crisis. Really take a close look at and adjust your infectious disease protocols. I mentioned this earlier. Best practices done consistently are important here, but some of the infectious disease protocols may be confusing. They may be new. So we want to make sure, if anything, this is something we do well. This is something we approach 100% efficiency with. This is something that is not an afterthought. And again, since it's done every day, you have to remind staff, you have to model with staff all the time, because people who do something every day get lazy. They habituate, and we don't want that to happen. We want them to be able to practice this at a high level of efficiency. Identify potential staffing issues, which you may have already gone through. Begin acquiring PPE. Again, what's your program like, and do you have the necessary personal protective equipment? If not, how are you going to acquire it? Do you have enough supplies? We burned through a lot of this through the COVID epidemic, and we want to make sure going forward we have a reasonable supply or reasonable relationships with providers who can get us this protective equipment. We want to educate families, staff, and registrants about safety protocols. This is not only good healthcare practice, but remember, this is going to be a part of your marketing, because families are going to be asking and registrants are going to be asking, am I safe to come back to you? And you're going to have a pretty clear and pretty concise answer to why they will be safe. Work with your team to identify issues particular to your program. Guys, I respect every program. I recognize they're all unique. They all serve different populations. They all have their own strengths and weaknesses. So you may have to do an inventory of your own program, of what you bring to this, that makes your program different and may present unique challenges. And that's it. I hope some of what I shared stimulated some thought, introduced some ideas about what you're going to be facing, and more than anything, that you walked away with maybe 2 or 3 ideas that you find helpful. So I do think we scheduled some questions and answers if you've been sending them in, and I'll turn this back to Jeff.
Thank you, Dr. Figlarski. This is really great. We've got a few questions that have been submitted, so I'm going to go ahead and read those now. Can you give some tips on how the leader or program director can manage emotions, such as feeling overwhelmed, depressed, angry, etc., during the workday?
Sure. You know, I'm gonna start. Something I was going back many, oh my God, I'm going back into ancient history. When I was at my internship, I had a supervisor who once said to me, you know, I was a very wide-eyed and eager psychologist, going to go in and do a good job, and you know, full of all this energy. And my supervisor said, "Slow down, slow down. You're going to get eaten up, and you're going to get all misdirected." And what my supervisor conveyed to me is, in terms of the situation and the person in front of me, that I'm the barometer. And she said, "You're like a piece of equipment. You have to make sure you're finely tuned." And I think that's where it starts. I mean, you know, in your leadership role, you're not a therapist to your employees, but certainly there are similarities in terms of listening, being reassuring, and being supportive. So one of the first things is, what is your take on yourself? What is your barometer of yourself and your reactions telling you? You know, it's very hard to be reassuring if you're really anxious, if you're really worried. It's, you know, sincerity and connectedness to people is not something you can fake. And you really need to have a good understanding of what your feelings and thoughts are. And looking at it critically, not judgmentally, but critically, of what's your take on this? What are your feelings about this? And understanding your feelings are not the only set of feelings. Your feelings are not necessarily the right or wrong feelings, but they're your feelings. And sometimes people in leadership roles have difficulty with that, you know, to accept their feelings in a non-judgmental way, to better understand why they're having them, and identifying them, because you now interact with other people, and knowing your feelings allows you to tune into theirs and to be able to validate and to listen. So that's certainly one. Know yourself. Secondly, is to be able to accept what you're being told in a non-judgmental way. Listening, allowing that person to be the individual. Listen, if they're presenting this to you, they have some degree of confidence, trust, or need they're bringing to you. So try to be and work to be non-judgmental. Listen, you'll never do this perfectly. We're human beings. We foul up, we screw up all the time. So it's not an issue of doing it perfectly, but intention is something that comes across very clearly. So be understanding, be empathetic, recognize, very importantly, is this something at your level you can handle? Is this about educating? Is it about a pat on the back? Is it about appreciation, offering a little support? Or perhaps is it more serious? You know, you don't want to take on supporting someone who's depressed where they really need a higher level of care than what a supervisor, or in this case, a program director, might be able to offer. So those are just some general ideas. I hope you find those helpful.
Can you give some examples of your concerns related to HIPAA violations?
Oh, yes. Yeah, HIPAA violations. Hi, this is Mrs. Smith. my mom's in your program, and I heard that Sheila, who sits at her table, has COVID. What's going on with Sheila? Are you having an outbreak? I heard that Marty was sick too. What's going on with Marty? I'm sure there's some people smiling at that, because that's exactly what's going to happen. I mean, you're in a community, and a patient, a registrant can't violate HIPAA. So they're going to take information about your operation and about people they know and people they interact with, and they're going to go home and they're going to talk to their family members, and their family members going to get on the phone immediately and begin to demand information about other registrants, or about what are you doing, or what is that. So we're going to have to, and believe me, that demand is going to be emotionally charged. And these family members, because they see themselves as advocates for their loved one, is going to be pressing hard on your staff about particulars that clearly we cannot share. So you might even want to rehearse that a little bit. You might want to tailor a couple responses. Oftentimes I find staff say the wrong thing because they're not sure what to say. So there's nothing to say in terms of this HIPAA that you can't write a script, couple short responses, give them to your staff, have them practice it, let them make it their own words. So when they know they're going into HIPAA territory, what can they say? So that's an example. That's certainly one where we might share too much information because we feel pressured by a family through their anxiety or their bullying to reassure them and say, Mike doesn't have COVID. Well, guess what? That's healthcare information. We talked about Mike. So even sharing the negative can be looked at as a HIPAA violation. We're talking about Mike's care to Stella's daughter. So anyway, there you go. So that's an example, and I'm sure probably the most common that you're going to run into.
If team meetings turn into venting sessions, how can you direct? Can you talk more about this?
Yeah, I think you have to take just like every good comedian, you got to take the pulse of the room. And if you're in a meeting, a meeting that turns into a venting session is really diagnostic for you as the leader, okay? It means that you're not tapped in to what's going on with your employees. 2, perhaps you're running meetings too loosely with not a kind of set agenda. Lynn, the reason to call a meeting is because you see it as something that is constructive. Challenge yourself to say, constructive in what way? Constructive how? What would a good meeting outcome look like? So some of these questions help structure you going in. So if you do find yourself all of a sudden in front of a meeting and everybody is venting, I'll remind you of this again. The pull then for the leadership, the person in leadership position, is to take control. It's probably not the most productive though, because all you're going to do then to take control is kind of squash dissent. And that usually doesn't work well. Or if you're authoritative in your approach, you're going to suppress expression, which is not helpful either. I think listening is probably the most effective thing. Remember, listening is not agreeing. I think what you can do to make a venting session productive is remind everybody that they need to be respectful. They need to be thoughtful in how they convey it, that you're not going to tolerate an attack session. So there is structure in a venting. If a group meeting turns into a venting session, there is some structure you can in terms of the rules and how you'll receive this information or how it should be addressed. but to find yourself, if it devolves into you arguing with the staff or being authoritative, it's probably counterproductive. And that's the scary thing about venting meetings. They take on a life of their own. And as a leader in that situation, you try to steer it to the most productive outcome. And there's not a lot to say, more to say about that. I mean, it's a whole probably training program to begin with. But I think what you want to do is try to hear the message underneath. Question yourself, perhaps, whether this is a venting session because you're not tending to the individuals enough and knowing what's going on. Think about how you might lead your next meeting, because you can't shy away from them. And understand what the dynamics were leading up to the venting session.
We have one staff person who consistently brings down the morale of others. Can you talk about how to deal with this?
Yeah, I always tend to marginalize them, believe it or not. If you have a good team, you work with what's positive. You build your team morale. You set the normal in your atmosphere. The normal for our program is we are optimistic and upbeat. You work with your staff to catch them doing things that are right. You do positive tours, and then obviously everybody has their own personality. So there are people who are going to be negative. They're not going to like this. They're going to undermine. Depending on the extent of how well you can build your team around a positive, optimistic attitude, they become less and less relevant. If they really do become caustic, it is appropriate to bring them in because they're undermining your work and say, listen, Susan, you've been, I've noticed, sometimes in meetings, facial expressions, I've noticed some comments that tend to be negative. And I'm concerned. I'm concerned that you're not happy with the direction the program is going. I'm wondering if you have concerns that you haven't been able to bring to my attention. And I want to use this as an opportunity for us to better communicate. Don't make it about the person. Make it about the program and what you're seeing. Because if you make it personal, then it becomes you and Susan. What you do is want to make it about you, the direction and atmosphere of the program, and Susan. If you follow what I'm saying. So we want to disempower them in a constructive way, because listen, if Susan can adopt the practices you're trying to establish in a program, Susan is going to be a better fit and Susan is going to be happier. So as a manager, or in this case a leader, what I'm thinking is, how can I help Susan be a better fit? I want to approach Susan in the most positive terms possible in terms of making my program better. And that's the quality of the conversation I want to have with that person. But there is a power we have to acknowledge, and it's a power of negativity, a real power of negativity. And if we respond to negativity and we feed into negativity and we try to get people to change their negativity, what we do is empower. It's a power of no. And I try to keep my focus away from that. I stay optimistic. I stay with the people who are positive, winners, upbeat, and I kind of invite that person to be a part of that team. And ultimately, if it escalates, there's always the understanding that perhaps they are not the right fit. Not because of who they are, but because of this is where the program is going. This is the atmosphere we're trying to establish. And it seems you're having a challenge with that. How can I help you be a part of this team? Because I value your knowledge, I value your work ethic, but I want you to be a better fit. So we always try to keep it positive, all right? And emphasis on the positive.
And it looks like those are all the questions we have.
Well, I want to thank Ann and Jeff and Bill and everybody over at the foundation for giving me the opportunity to participate today, share some of my thoughts. And as for the participants, I wish you all the luck in the world in getting your programs up and running. I started this whole presentation by talking about the value of what you do. I cannot tell you how sincere that message is. You're keeping people with their families, you're enhancing their quality of life, you're helping them manage medical conditions. The work you do is so, so important. And I'm just hoping we can get you all open and that you can run a program you're proud of. So best wishes to you all.
Thank you again, everyone, for joining us today. And we hope to have you back next week for our third free webinar titled ADHD Without Walls: Benefits, Barriers, and the Business of Telehealth. Registration is available on the Adult Day Healthcare Council website at adhcc.org. Thanks again and enjoy the rest of your day.